Hello everyone, welcome to KB Lim Skin Clinic. I'm Dr. Lim. This is a short video on psoriasis. Psoriasis is a skin disorder caused by the rapid division of keratinocytes or skin cells, leading to a buildup that results in the thick red scaly plaques that are characteristic of psoriasis and shown in this photo. Doctors believe that three factors interplay to cause psoriasis: 1. Genetic factors, 2. Immune dysfunction, and 3. Environmental triggers. Let's have a look at these. 1. Genetic factors. A family history of psoriasis can be obtained in 50% of patients, and the risk of an offspring developing psoriasis is 28% if one parent is affected and 65% if both parents are affected, according to a large Scandinavian study. Further evidence for the genetic basis of psoriasis have come from genetic studies conducted using traditional as well as modern techniques, in which psoriasis susceptibility genes have been identified in certain locations on the chromosome. 2. Immune dysfunction. The immune system normally produces T cells to fend off attacks by foreign invaders. In psoriasis, these cells attack healthy skin cells, triggering an immune response as well as stimulating keratinocyte hyperproliferation. Doctors believe that keratinocyte injury may be the initiating event. Dying or injured keratinocytes release their nucleic acids, and the released nucleic acid activates dendritic cells in the skin. Activated dendritic cells release inflammatory cytokines such as interleukins, IL, human necrosis factor, TNF, and interferon gamma. Several interleukins have been implicated in the cause of keratinocyte hyperproliferation. I've listed here two of them, interleukin 17A and interleukin 22. The keratinocyte hyperproliferation is very characteristic of psoriasis, and in a normal individual, it takes a newly formed keratinocyte. This is formed at the basal layer of the skin to move upwards and differentiate and eventually become a coniocyte or a dead keratinocyte to be shed off as scales. It takes it 28 to 30 days. This is in a normal individual. In a patient with psoriasis, this is shortened to just 3 to 5 days. So this is an indication of how fast the keratinocytes are proliferating, dividing, and how fast the epidermis is changing over. It's changing over every 3 to 5 days instead of 28 to 30 days. And the short keratinocyte or the cell renewal or turnover time results in the accumulation of thick scales that we see in psoriasis. So let's briefly review what we've said so far. Internal factors such as genes make a person susceptible, and immune dysfunction leads to chronic inflammation that causes the skin changes we see in psoriasis, and keratinocyte injury probably initiates the abnormal immune response, the immune dysfunction. 3. Environmental triggers. It has long been observed that psoriasis tends to occur in areas of trauma, such as along scratch marks, and this is known as the Koebner phenomenon. So this is a direct evidence of keratinocyte injury leading to psoriasis. Other triggers include infections such as Beta-hemolytic streptococcal sore throat infection, which may cause a type of psoriasis known as guttate psoriasis. Other triggers include drugs, emotional stress, alcohol, tobacco, smoking, cessation of steroids, and so on. Psoriasis appears as well-demarcated, well-defined red papules or plaques covered by thick, silvery or shiny scales, and psoriasis patients often have nail changes as well, nail involvement, and this can be found in as many as 40% of psoriasis patients. This patient has plaque psoriasis. A plaque is simply an elevated patch. You can see the silvery scales on the surface of the skin. Plaque psoriasis is the most common type of psoriasis. This person has guttate psoriasis. Guttate means raindrops. It's a small version of plaque psoriasis, and you may remember we mentioned earlier that streptococcal sore throat can cause guttate psoriasis. So this is the child who has guttate psoriasis. Psoriasis commonly also affects the scalp, such as on this patient's scalp behind the ears. Again, you can see it's well demarcated, well defined, and covered by thick scales. Psoriasis can also cause pustules on the palms, as seen in this case, a lot of pus heads on the inflamed skin on this patient. In some patients, these occur all over the skin and it causes a generalized pustular psoriasis, sometimes known as warm Zumbush psoriasis, which is a very severe and difficult to control type of psoriasis. Some patients have a very extensive psoriasis that affects the entire surface of the skin, and this is known as erythrodermic psoriasis. These patients shed huge amounts of scales every day. This is a patient with nail psoriasis. If you recall, it affects 40% of patients. You can see pitting of the nail plate as well as onycholysis. Onycholysis refers to the lifting of the nail plate from its attachment to the nail bed. So this occurs in 40% of patients with psoriasis. Complications include arthritis that can occur in 30% of patients, comorbidities such as cardiovascular disease, type 2 diabetes, and metabolic syndrome, which is constellation of insulin resistance, high blood sugar, obesity, and dyslipidemia, and so on. And we also have the psychological complications, such as loss of self-esteem, reduced quality of life, and even depression. This patient has psoriatic arthritis affecting all the finger joints, extremely painful, debilitating, and affects the function of the hands. Psoriasis is usually diagnosed on clinical examination history. A skin biopsy is not routinely performed unless the diagnosis is uncertain. Psoriasis can be graded according to its extent and severity. Commonly, we use the PASI score. PASI stands for Psoriasis Area and Severity Index. Quality of life, psychological suffering, can be measured according to the Dermatology Life Quality Index, or the DLQI. Psoriasis may be treated with topical agents, light treatment, immunosuppressants, oral retinoid, and immunomodulatory agents. Let's have a look at these. Topical treatments include emollients, which are moisturizers, keratolytics, which work by softening the scales, aiding their removal, coal tar and anthralene corticosteroid creams, vitamin D3 analogs of calcipotriol. They help to reduce the epidermal turnover, and they also some of them help to reduce inflammation. Tazarotene is a topical retinoid, which I will mention again later on. This is applied to the skin. Light treatment may utilize either ultraviolet B, UVB, or ultraviolet A. Ultraviolet B is often used, and currently the most popular form of ultraviolet B is narrowband UVB. UVA is often used with prior taking of a light sensitizing medicine called Psoralen. So this is known as Psoralen UVA or PUVA. In some patients with psoriasis, they may have a few remaining patches of psoriasis that are thick and resistant to all types of therapy, and these patients may benefit from Excimer laser treatment. Excimer laser penetrates deeper and can help to improve these very thick, recalcitrant, persistent patches, plaques of psoriasis. Immunosuppressants are usually used when topical and light treatments do not work. They include drugs such as methotrexate, cyclosporin, mycophenolate mofetil. These work by suppressing the immune system. They work well, but they have side effects, hence treatment has to be closely monitored. Oral retinoid, the main agent here is acitretin. We mentioned a topical retinoid. This works by reducing inflammation, and it also helps to reduce the keratinocyte hyperproliferation, and the rapid turnover of the epidermis that we mentioned leads to the accumulation of scales in psoriasis. So this is also very effective. However, it must be used with caution in female patients because it can cause malformation in the baby if they get pregnant. Another consideration is this drug remains in the body for 3 years after stopping the drug. Hence, in a female patient, pregnancy has to be avoided for 3 years following the cessation of treatment with acitretin. Immunomodulatory agents are the latest, is the most significant advance in the treatment of psoriasis. We mentioned about the inflammatory cytokines. Biologic agents are basically proteins or sugars produced by living organisms. They work by blocking the inflammatory cytokines that I mentioned earlier, such as tumor necrosis factor, TNF, and here's a list of them. Some block interleukin 23, and the list of them, and that some block interleukin, and finally there's some drugs that block phosphodiesterase 4. All these treatments reduce inflammation, and they are extremely effective. They can really clear psoriasis. The main limitation is basically the cost that actually limits its wider use, because these drugs are produced in small quantities and they are expensive, and because psoriasis is a chronic disorder, the cost of treatment can be substantial. In addition to treatment, always remember that it's helpful to keep the skin well moisturized so that they don't crack. Avoid scratching, which you've heard keratinocyte injury leads to psoriasis. Psoriasis can actually develop on scratch marks. Avoid systemic steroids in particular, because steroids work very well. These are systemic steroids, are steroids taken by mouth or injected. They work extremely well, but when they stop, it flares with a vengeance, and very often patients develop the erythrodermic psoriasis I mentioned earlier on that affects the entire skin, or may cause pustular psoriasis that affects the entire skin. These are very difficult to treat, and hence systemic steroids should be avoided. Other triggers that may worsen psoriasis is obesity, because this leads to increased friction in the pole areas. Sunlight is helpful, but if you get sunburn, it induces keratinocyte, and that makes psoriasis worse. So a bit of sun is good, but not too much. In addition, maintaining good physical as well as mental health is useful, and joining local support groups where you can exchange information and tips, and also provide support for fellow sufferers. So I hope you found this short presentation useful and informative. Please visit us at our website www.kblimskinclinic.com, where you can view more videos as well as read about different skin conditions and the treatment of these conditions. So I'd like to thank you for watching, and I hope to see you again. Goodbye.